Hi guys. So in this video, I would like to answer a question on the streaming, whether to go for hospital or industry. And this is a very good question. One of you actually asked me earlier, but I think this is a bit more, this is what is in a lot of people's mind. Yeah. Um, does do people actually take clinical pharmacy streaming because it's safer, all right, and you're not sure whether you actually choose the wrong stream. Okay, and in the second part of the question is that you wonder what are the pros and cons of taking research, and would it make a difference if you take research, would it affect your future, all right, and you're still not sure whether you are the research kind, whether you can commit until the end of your project and so on and so forth. Okay, so let's see, all right, between the hospital and industry, or the hospital research, right? So these are two different or three different areas. Yeah. In hospital pharmacy, you'll be going for clerkship in the hospital, maybe in GH Penang, maybe in Seberang Perai, and so on. Yeah. In other words, you'll be exposed to the practices, the clinical practices out there. You will also doing some simulation and clerkship in the school as well. All right. So to me, I think this exposure will give you a better idea whether you'd like to actually invest your time in the hospital pharmacy as your career, being a hospital pharmacist as your career choice in the next maybe 10 years and 20 years. All right. Now, research or industry. Industry actually can be divided into the manufacturing side, whereby you'll be doing a lot of quality assurance. You'll be talking about the looking at the product registrations, and you'll be seeing you'll be working in a factory. Okay. To some people it's okay, to some people also for research is a very nice way for them to get to know themselves. The one thing good about industry, I can see that if the factory or the manufacturer has got a position for you, then you can after you have graduated, you can straight away sign up for the job. So the job is ready for you. Okay. Whereas in hospital, you have got to wait until any posting is available. That's one. Now, the second part of the industry is also is about the manufacturing side, yeah, whereby the industry doesn't really, you don't actually deal with face to face. You don't actually deal with the factory side. You're more involved in the business side, which is you're probably more involved in the marketing, the promotion of the products. You'll be traveling a lot. You'll be seeing your clients. Your clients may be doctors, pharmacists, nurses. Even your clients could be also the people on the ground level. Yeah. So this is one side of the industry that a lot of us are not exposed of. So if you are curious or interested, if you like to go, if you like to meet people, if you like to be, if you like to socialize, I think this is the non-manufacturing side is very good for you. Let's talk about research. All right. So in research is mostly about independent work. Is about also designing your experiment is about a lot of readings. Not saying that the clinical pharmacists have less amount of reading to do, but in research you be researching, meaning that usually a supervisor will give a research topic based on a paper, and then what you do, you will actually read through the paper, have a look at other papers that is related to that particular research paper or that particular research field, and then set out there to do usually a bench work. Okay, so and you can also do research in surveys. Handing out surveys and see the perception of people or patients towards certain drugs or medication, for example in diabetes, or how they use it as well. So I think for me, if you are doing research, it's more if you are the person who are curious, inquisitive, and like to know more about yourself. Let me give you this analogy. All right, if you are here, right, and at this one end of the river is the future. Okay, and what you see normally, all right, perhaps your friends, your classmates, they are probably more geared towards this particular route, which is, it seems from your end, is actually shorter, therefore you think is safer, less risky. Oh yes, from this end it looks really smooth, it looks really cool. All right, but now just consider if you have another route. This is actually a bit longer. All right, it looks a bit riskier as well. All right, so the question now, which route will take you to your future? Honestly, from my perspective, I have experiences in hospital, retail, and now I'm actually in education. At the end of the day, by the end of your fourth year, you are still going to be in pharmacy. Well, hopefully you're still going to be in a pharmacy. So to me, that it really doesn't matter at this point. Because it's just, to me, it's like another year, a year and a half. That said, let me just put a disclaimer. That said, I would imagine if you are taking the longer and riskier route, where a lot of successful people usually take, they know there's a big risk. They know they might also fall really hard, on their face. Usually, they might be more successful than they ever imagine, than they ever dream. The riskier the route you take, most of the time, it will reward you with greater profit. What I mean by that, if you do fall hard, you could learn from the lesson. That's the thing you will learn. And there are other things that failure can teach you. The value of failure is higher than going on the safe side. I'm leaning towards also, you see, this is a quote by Mark Twain, that just another tool to to think whether you want to go, which route you want to go, is to think like now you are 19 years old, now you are 20 years old. Think when you are 40, and when you are 40, and try to look back. Yeah. And just imagine, what if you take the safer route? What do you think you would lose? All right. If you also take the safer route, what do you think you would gain? Okay. And if you take the safer route, you think, what do you think you would be, what are the interesting things you would actually also learn? All right. So think about it. Yeah. For me, I would go for the riskier route, the unknown route, because to me, when I look back, I have less regret. Yeah. I knew that I have actually explored. I have actually discovered new things, not just about the things around me, but also new things about myself. Yeah. So explore, dream, and discover. With that, thank you for watching the video. I see you then.